What is compounding? Pharmacy compounding is the art and science of preparing unique and individualized medications for patients. Compounded medications are safe and effective treatment options for patients. Prescribers customize prescriptions for patients when they believe compounded medications are that patient's best treatment option. Here are some instances where compounding is beneficial for patients. When patient is allergic to a particular preservatives, dyes, or binders that are in manufactured products. When medication is not in dosage form that is commercially available, such as transdermal gels, troches, suppositories, suspensions, flavoring, lollipops, and animal treats. When a treatment requires custom-fit dosage strengths for patients with unique needs. When pharmacists can combine various compatible medications into a single dosage form for easier administration and improved compliance, and when commercially available medications are on back order. How is compounding regulated? All pharmacies and pharmacists are licensed and regulated by state boards of pharmacy. Compounding pharmacies has always been regulated by state boards, which are constantly updating their standards and regulations. Since we are shipping to 44 states, we have to be constantly keeping up to date of all the different states' regulations. In addition, standards set by the United States Pharmacopoeia, or the USP, are integrated into the practice of pharmacy compounding, particularly USP Chapter 795 for non-sterile compounding and 797 for sterile compounding. The Pharmacy Compounding Accreditation Board, or PCAB, is a non-profit organization that has developed national standards to accredit pharmacies that perform a significant amount of compounding. There are about 290 PCAB accredited pharmacies, and the number is less for both sterile and non-sterile compounding. In Washington State, there are 5 pharmacies that are PCAB accredited for both sterile and non-sterile compounding. And lastly, the compounding pharmacies are also regulated by FDA. How do we ensure that we are providing safe and quality preparations to our patients? Compounding is like baking. You need to know how to select the best and correct ingredients, the right recipes, the skills to follow direction, the right environment, and the right equipment. Just like baking, compounding a medication requires knowledge, patience, and adequate time to complete. First, the pharmacist research and develop the master's formulas for each compound. We buy our chemicals from FDA-registered facilities or other reputable companies. We require the certificate of analysis of all chemicals from the vendors or manufacturers, and also send out final preparation to third-party lab for potency testing to ensure the quality of the preparation. All sterile compounds are tested for sterility and endotoxins in-house, and also routine validation from third-party lab. Our facility and equipment undergo validation and certification at least every 6 months. We also have policies and procedures for training and process validation for our compounding personnel at least every 6 months. After compounding, quality checks of all final preparations are performed by the pharmacist. At Key Compounding Pharmacy, we believe that only when people take charge of their health are they empowered to achieve a better quality of life. What better way to do it but to educate our community of staff, patients, and healthcare providers and empower them to make informed alternative choices for improved health and wellness via personalized medicine. We also stand by our brand and actions by exercising our core values every day: teamwork, integrity, purpose, and positive attitude.
Key compounding pharmacy is freedom,
Purpose,
awareness,
trust,
quality,
well-being,
choices,
sharing,
adaptability,
options,
safety.
focused,
holistic.
connection.
Key compounding pharmacy is personalized.
It's a great atmosphere at Key Compounding Pharmacy, and there's a lot of teamwork that goes on every day.
At Key Compounding, we believe only when people take charge of their health are they empowered to achieve a better quality of life.